Good morning, my name is Liza W, and today Casey Williams and I will be presenting the theory of health empowerment. Pinder's theory of health empowerment is also known as the health promotion model. This theory aligns with middle range theory due to the complex multi-dimensionality of interpersonal and environmental interactions as one seeks higher achievement in health. Pinder based this theory on human behavior and its connection to primary prevention as well as health promotion. It places emphasis on the person's desire to prevent illness or seek a greater well-being and self-actualization. Pinder's parent models are expectancy value theory and the social cognitive theory. The purpose of the health promotion model was to be a complementary counterpart to models of health protection. It was developed to encompass behaviors for improving health and applies across the lifespan. Its purpose is to assist nurses develop knowledge and understanding the major determinants of health behaviors as a foundation to promote well-being and healthy lifestyles. It was also evolved to explain the interactions that occur between an individual and their environment during the behavior change process. The goal of the health promotion model is to help individuals make behavior changes that will improve health outcomes in addition to preventing and minimizing the risks of disease and live their definition of a healthy life. One theory that shares the same concepts as the health promotion model is the health belief model. It incorporates fear and threat in a disease as a motivation for action, while the health promotion model does not.
So these are the major constructs of the health promotion model, starting with individual characteristics and experiences. Prior behavior and personal factors have a direct and indirect effect on the likelihood of someone engaging in health promotion behaviors. Second, we have the behavior-specific cognitions and affect. These serve as a motivational significance in this theory because they are subject to change by the nurse. And finally, we have the behavioral outcome. This is arguably the most important because the commitment propels the person into the behavior unless that action is confounded by a competing demand. So the scientific underpinnings of the health promotion model are derived a lot from Parse's theory of human becoming. In Parse's theory and eventually Pinder's views as well, the environment is everything in the person and as well as their experiences, encompassing the ontological views of what it means to be in the health promotion model. The environment is inseparable from the person as well as complementary to and constantly evolving with the person. And health is seen as the open process of being and becoming. The health promotion model has been utilized in a variety of clinical and non-clinical settings. It's very readily accepted because of its holistic and humanistic views. With the incorporation of individual lifestyle, environment, and beliefs, nurses can better treat patients to provide holistic care in many different settings such as schools, workplaces, rehabilitation centers, and even prisons. Now we're going to transition into the internal and external criticisms of the health promotion model. Liza will begin by explaining our views on the internal criticisms, and I will follow up with the external criticisms.
To the adequacy, we must first understand the mission. In Chapter 15 in Middle Range Theories, McCall states on page 226, Pinder's definition of health is positive, comprehensive, unifying, and humanistic. To do so, we must include all aspects of the person. After discussing, Casey and I agreed that the health promotion model does just that. Pinder addresses these through characteristics and experiences in the form of age, BMI, puberty stage, and physical capabilities. Psychological factors of self-esteem, self-motivation, and perceived health status are included, along with socio-cultural of race, ethnicity, education, and economic status, along with the influences of family, peers, and health providers. Together, these factors create idiosyncratic care for each patient. As stated previously, the health promotion model focuses on health efficiency. Therefore, limitations may include the avoidance of fear and threat of a disease that is incorporated into the health belief model. Casey and I discussed the clarity of this model and theory, and we decided that it is less complex than other theories and models. Although many different factors play a role in the positive, comprehensive, unifying, and humanistic health that Pender speaks about, the health promotion model is easy to understand and pretty straightforward. Additionally, the phenomena are familiar within the nursing community, and the concepts require little literature learning. As Casey and I were discussing this theory, we did find that there was much consistency with the concepts and terminology, interpretations, principles, and methods. We believe that the logical development was pretty sound when Pender developed the theory of health empowerment. She utilized the expectancy value theory along with the social cognitive theory, both of which share similarities of human desire to strive for goals that are achievable. Additionally, it does follow a line of thought in terms of research development and advocacy needed as determined by the individuality of each person. After researching, we found that the health promotion model has been and used in various populations, settings, health behaviors, and client characteristics. As Casey and I were discussing this theory, we did find that there was much consistency with the concepts and terminology, interpretations, principles, and methods.
Beginning our external criticism of the health promotion model, as far as complexity, there are only 3 components in the model that we discussed earlier, and although each of them are highly complex and intertwined with each other, the model itself is very easy to understand and straightforward, as stated previously. The phenomena discussed in the model are familiar with us, and the concepts require little new explanation. Discussing the discrimination of the health promotion model, there have been many instruments developed to measure a variety of concepts concerning our model. Questionnaires such as the Health Promoting Lifestyle Profile enable us to develop and test hypotheses that lead to results displaying how well our health promotion efforts are working. This theory is not unique to any specific area of nursing. It can be applied in many different clinical and non-clinical settings. However, it does have clear boundaries on its goal and definitive parameters on what we want for our patients as far as health promotion. The assumptions developed from the health promotion model do reflect the nursing and behavioral science perspectives. They do ring true as people do desire to be in control of their lives and they have the capacity for self-awareness. Growth is valued in the real world and people do interact with their environment to constitute change and eventually transform themselves. The assumptions also represent the holistic views and goals of nursing. As discussed previously, the health promotion model can be operationalized in real-life settings, including in clinical and non-clinical environments such as rehabilitation centers, prisons, schools, urgent cares, and even in the acute care hospital setting. Because the health promotion model is so applicable to our practice as nurses, we have determined that it is a very narrow scope of practice because it directly applies to us as nurses and the influences that we can have on each individual patient's overall health. For example, in the ICU, the health promotion model can be applied to any patients, even by performing active and passive range of motion for the goal of improving health conditions and preventing further debilitating injury, as stated as one of the goals of the health promotion model. Promoting health and wellness in our patients is one of the overarching goals and priorities of nursing care. The research obtained from the health promotion model will influence how nurses implement their interventions with their patients, depending on the health outcomes achieved by each intervention. So, the health promotion model does in fact address issues that are essential to nursing care and to the overall health of our patients. This concludes mine and Liza's presentation on the health promotion model. We do hope that it was informative and provided some new insight and perspectives into the health promotion model, which is so evidently a model that we utilize in all aspects of our nursing care. Here are the references that we used for some of our information, and if you have any questions or concerns, just reach out to us and we'd be happy to discuss our model. Thank you so much for watching.